This section is communication and pain. We look at the nursing assessment first. We assess the patient's hearing. We tick whether it's good, poor, have they a hearing aid, is the hearing aid with the patient. We assess the patient's vision, good, poor, wears glasses, contact lenses, glasses or lenses are with the patient, yes or no. The patient's speech, clear, incoherent or slurred, voice, hoarse, wet or gurgly, clear or other. First language, difficulty following instructions, if so we tick the box, difficulty expressing themselves and word findings, and any behavioural or emotional issues that might impact on the patient's ability to communicate. Does the patient have any other pre-existing conditions that affect their ability to communicate? Yes or no, and you can specify there. So if we realise that there is an issue with communication, we can activate the Care Plan 2A, impaired communication due to, and we can document the reason there. The expected outcome, able to use a form of communication to get needs met. So the interventions here, introduce self to the patient, face the patient when speaking, use any aids required, liaise with speech and language therapist, allow patients to express feelings, liaise with patients next of kin, engage help of interpreter service, give written information in patient's first language where available, other strategies adopted, and we can document there, and we have blank spaces here if we want to write in our own interventions. So remember, we only activate the interventions that are relevant for our individual patient. So the next part of this section is the pain assessment. So does the patient have pain? Yes or no? If they have, where is the site of the pain? Their baseline or current pain score can be documented there. Is it acute pain or is it chronic? A description of the pain, is it sharp, dull, throbbing, burning, aching, cramp or other pain relieved by? And has the patient been educated on the current pain management plan? Yes or no? So if the patient has pain, we will need to activate Care Plan 2B. Patient has acute or chronic pain. Okay, so we tick whichever box is relevant, and perhaps both are relevant. Expected outcome, reports reduction or relief in pain and appears comfortable. So these first two interventions here are highlighted in yellow, and that means that we need to activate these two for all patients because it's relevant for all patients. So assess pain using numerical pain scale, the pain assessment tool, record on news chart. Post-intervention for elevated pain score, pain is reassessed and documented using appropriate pain assessment tool within 1 hour. For advanced dementia or non-verbal patient, assess using the pain aid on page 8 and record scores in daily evaluation. So the pain aid is an assessment that we use to identify if a patient who has advanced dementia or a patient who is non-verbal, to identify if that patient has pain based on their behaviours. I go into a more detailed explanation in that in maintaining a safe environment if you want to look at that presentation. The next intervention here is document pain characteristics, administer regular and PRN analgesia as prescribed, liaise with appropriate clinical nurse specialist or medical team if pain level is not acceptable to the patient. If PCA analgesia is in progress, monitor as per policy, record assessment on PCA chart. If subcutaneous infusion pump in progress, monitor and record 4-hourly assessment as per policy and educate patient on non-pharmacological interventions, for example repositioning, heat, ice, and then we have our blank interventions there.